Hi, my name is Danielle Bojorquez. I am a second-year medical student at the University of Washington on the Spokane campus. I completed my summer RUOP experience at the Sidney Health Center in Sidney, Montana. The focus of my community health project while in Sidney was providing education interventions to improve adolescent mental health. Sidney, Montana is located in the northeastern region. It's the largest city in Richland County with a population of about 6,200 people. Notably, the suicide rate of Richland County is almost double that of the national rate, and the ratio of mental health providers to patients is 770 to 1. Mental health in adolescence was brought up as a major public health concern through my community interviews with providers and community members. In 2019, a community needs assessment conducted by the Sidney Health Center and the Montana Office of Rural Health showed a need for mental health services and resources in the community. My literature review was primarily focused on identifying possible interventions for improving mental health in adolescents, specifically those living in rural areas. Research showed that mental health promotion in the high schools increased both mental health awareness and literacy of adolescents. One potential intervention that was cited was mental health first aid in high schools. Mental health first aid is a training program designed to give individuals the skills to identify and respond to those that are experiencing a mental health crisis, while also decreasing the stigma around mental health. When developing health education materials, I worked closely with the Communities in Action mental health advocate at the Department of Health. One of our goals was to increase mental health awareness at Sidney High School, which is the only high school in town. We created flyers with information about mental health, primarily focusing on anxiety disorders and suicide prevention. During my time in Sidney, I learned that the local mental health advisory committee had already started to offer mental health first aid trainings to community members. So with my community partner, we created a strategic plan to coordinate mental health first aid trainings at the local high school with the teachers. The goal being that these teachers would then have the ability to communicate with their students about mental health and connect them to resources in the community. Various community members also expressed a desire for information regarding mental health resources in the community. We reached out to all the mental health and substance use providers in Sidney and created an updated list that could be accessed by the public. This double-sided handout included basic information about providers, the services they offer, insurances that they accept, and whether or not they offer telehealth. We also included a list of numbers of various crisis lines in the region. After completing the health education materials, we developed a distribution plan for them. Prior to completing my RUOP experience, I was able to distribute the mental health provider list to Sidney Health Center staff, as well as other health providers in Sidney. However, my community partner was actually completing her AmeriCorps service in Sidney, and so we created a plan for her replacement to distribute the materials to the local high school. We also passed on the strategic plan for the mental health first aid training in the high school, with the hopes that the training could be implemented by December of 2021. Lastly, I'd like to thank my community partner, Brenna Fox, Brittany Peterson at the Department of Health, and Marie Logan at the Sidney Health Center for all of their help with this project. And thank you all so much for listening.